My name's Noah Patrick. I am a physician extender and athletic trainer with Towson Sports Medicine and Towson Orthopedic Associates. Today we're going to be talking about ankle sprains. So what are the classic signs and symptoms of an ankle sprain? Kind of depends a little bit on the type of ankle sprain. So if we're having that classic inversion mechanism, we're going to see that tenderness right here in the sinus tarsi, which is kind of just a little pocket of soft tissue over that ATFL ligament right here. So we're going to be sore, swollen, kind of think of that goose egg or that golf ball over the outside of your ankle bone right here. We're also probably going to see some bruising appear as high up as just behind that lateral malleolus and typically following the base of the foot here. Even though the torn ligament that's bleeding is up here, gravity is going to kind of pull all that blood and fluid down more towards the base of the foot. So it's not uncommon for even sometimes for more major sprains, moderate to major sprains, to get some bruising and swelling down here up towards the toes. So what should you do if you've just sprained your ankle? So kind of depends a little bit on the type of ankle sprain in terms of whether we want to stabilize down here or up here for those high ankle sprains. So what I would generally recommend is that classic RICE, rest, elevation, compression, and ice. There's some variable literature now on some different acronyms. PRICE is a popular one that's being taught now, protected rest, elevation, compression, ice. If you want to take some medications, ibuprofen or Advil is fine, Tylenol is fine, but we want to stick with some pain relief in terms of like icing, compressing the ankle comfortably, try and get a brace or some kind of wrap or boot or something on it just to stabilize the ankle a little bit. So every time you're stepping on it, you're not having those little kind of micro re-injuries where you're pulling on that ligament a little bit extra, causing increased pain and swelling. I would say try and avoid excess activity whenever you can. So if you're just going to work, if you're just going to school and you can kind of modify some of your day, that's great. But I'd stay off the soccer field, stay away from football, skip your morning run for that day, just to give your ankle a little bit of a break. Even if you do have that brace, for those first 72 hours, it's really helpful to kind of let the muscles relax a little bit, let the nerves kind of reset, and minimize the amount of additional damage that you might be doing to any injured ligaments or, hopefully no additional fractures or anything like that in the ankle. So how am I going to rehabilitate my ankle after an injury? It depends a little bit on how you sprained your ankle, how severe the ankle sprain is, but generally we're going to think for those first 72 hours, I'm doing that RICE or PRICE, kind of just taking it easy for a couple days and incorporating some very gentle range of motion and anti-swelling exercises. We're going to think a lot of ankle pumps, a lot of ankle circles, things like that. From there, I'm going to progress into kind of a middling ground where I'm going to do some more basic exercises that are more intense than what I'm doing in the first couple of days, but not as intense as return to sport. Once I've passed a series of functional testing, my balance is improving, my pain is decreasing, I can start return to sport activities or return to daily life activities. Can I jog lightly? Can I start to run short distances? Can I walk on my toes, my heels, things like that before we go back to that morning run or back to soccer, back to football, lacrosse, things like that. So how would I return to sport after I've sprained my ankle? Depends a little bit, again, on how severe or what type of ankle sprain you have. But we're gonna do those basic exercises for those first 3 days or about 72 hours. Some slightly more advanced exercises working on range of motion, balance, and basic strength. And then we're gonna work on some more sport-specific activities. Some light to moderate jogging, maybe some cutting drills for lacrosse or soccer, maybe some planting skills for football, things like that. But for any additional guidance or more specific to you, you should speak with a physical therapist or your local athletic trainer at school, at wherever you frequent, for some more sport-specific or individualized advice. So we've got a series of exercises that we at TOA and TSM recommend performing for some basic rehab back to some basic activity before sports progression. So exercise 1 is going to be banded dorsiflexion and plantar flexion. So dorsiflexion just means we're pulling up. Plantar flexion means we're pushing down. This is going to help reduce swelling and improve some basic strength early on in those rehab phases. So I'm going to start by wrapping the band around my toes, kind of at the ball of my foot. And then I'm going to push down, press and hold, count for about 2 seconds, and then very nice and slow, come back up to that starting position. That's 1 repetition. For dorsiflexion, I can either tie the band to something, or I can use my other foot to create a kind of pulley, wrapping around the top of my foot. I'm gonna go up, hold again for about 2 seconds, and then back down nice and slow. For these, we're gonna do 2 sets of 15 for each direction. Exercise 2 is going to be banded inversion and eversion. This is going to do pretty much the same thing as that dorsiflexion and plantar flexion. We're reducing the amount of swelling in the ankle and improving that basic strength early on in the rehab phases. Just like the last one, we're going to loop the band around the toes. We can use the opposite foot as a pulley, or we can tie the band to something. For inversion, we're going to point the toes towards the inside of our leg or towards where our opposite foot would be. For eversion, we're going to pull our foot out or away from the opposite leg. Exercise 3 is going to be some towel swipes. Again, it's very similar to that inversion and eversion. We're reducing swelling, improving strength. This is also going to help improve our range of motion and some fine-tuned control very early on in those rehab phases. For towel swipes, I'm going to get a bath towel or a beach towel, something like this. I'm going to put my foot on top and pull over to the side, using my toes to kind of grip the towel. Once I'm in a pile all the way out on the side here of my ankle, I'm going to flatten the towel back out and pull to the opposite direction. We're going to do 3 sets of both directions, left and right. Exercise 4 is going to be alphabet writing. So more broadly than the inversion, eversion, dorsiflexion, and plantar flexion, we're really working on our full range of motion, going through all the degrees of freedom of the ankle and working on small changes through that fine-tuned, very fine motor skills. For this exercise, I'm gonna have my foot elevated up in bed, on the couch, something like that. I have a bolster here. I'm gonna imagine I have a pencil in between my toes, and I'm gonna draw the whole alphabet, A to Z, 2 times uppercase and then 2 times lowercase. Next is going to be marble pickup. This is a very basic exercise working on the intrinsic muscles of the foot, or the muscles that are only ever in the foot. A lot of the foot and ankle muscles come from up in the leg. And so this is going to improve some of those core, foot core muscles on the bottom of the foot and strengthen the toes to help with some more stability that's required for walking or for daily activities. Even though it's called marble pickup, it doesn't have to be marbles. You can use any household item, hair ties, dice. I have pens here with me today, so I'm just gonna demo with these. I'm gonna grab 15 items and I'm gonna pick them up one by one with my toes, using my toes to kind of scrunch up each, try and like vary the items so I can kind of get different positions of toes, use kind of different muscles to grip each. Once I've finished all 15 from this side and put them on the opposite side, that's 1 set, and I'm gonna do 3 sets of those 15 items. Next is gonna be working on single leg balance, kind of helping with what's called proprioception, or just your brain's ability to kind of communicate with the foot and ankle. So that proprioception is super important for sport-specific exercises like running or jogging, or daily activities just like walking. For this, I just want to balance on that one injured side 3 times for 30 seconds. Obviously, as you progress with exercise, this is going to start to get a little bit easy. So I can do a couple things to make it more difficult. I can start by taking my shoes off, so I'm losing that arch support. This is going to be a little bit more difficult than with shoes on. I can get a pillow or a foam pad, something like this. Do the same thing again. Now I'm on an unstable surface, or I can close my eyes. And then any combination of these things is going to be more difficult than in isolation as well. Next is going to be some very classic calf raises. For these, we recommend going through a more full range of motion, dropping the heel below whatever your toes are raised up on, whether that's a step or stool. The point of this exercise is to increase the general strength of plantar flexion. Again, very important for running and walking, but this is a little bit more of an intense exercise than some of those smaller banded exercises that we're doing with the foot. I'm gonna come up on a step or stool, something like this. If you have a set of stairs or a step ladder at home, that works just as well. I'm gonna drop my heels below where my toes are. I'm gonna come all the way up on my tiptoes, pause for a moment, and then nice and slow back down to that starting position. When you're first starting, it might be easier to be fully flat-footed up on the stool or down on the ground so that I can work through a more stable range of motion, but I want to work up to starting with my heels nice and low. I'm gonna do 3 sets of 15 of these. Last is gonna be toe walking. So when we're up on our toes, we're kind of incorporating all of the skills of the other exercises that we've already done, working on fine motor control, balance and stability, as well as the major muscles having gross support and strength in the ankle, making sure that those calves are nice and activated, that we're having really strong proprioception, that great mind-muscle connection between the brain and the foot, and making sure that we're having an easy enough time balancing on just that very small base of support. Next, I'm gonna be up on my tiptoes. I'm gonna take 10 careful steps forward, and then I'm gonna take 10 careful steps back. You're gonna repeat that 5 times.
Like and subscribe for more physical therapy and sports medicine tips. Please visit towsonsportsmedicine.com to learn more about our 7 locations and comprehensive services.